In this video, we will be going over major structures and landmarks in a coronal CT of the abdomen. Now, there are many structures located in the abdomen, such as a number of viscera, as well as branching arteries and veins. Since this video is just an introduction to what a coronal CT of the abdomen looks like, I will not be defining every structure in the abdomen, but mostly major viscera to give you an idea of where you are on the body when you are looking at a single image from a coronal CT. I will be pointing out a few more arteries and veins in this video compared to the axial CT video. So please make sure to consult your lecture materials on those topics we are not covering here today, since they are high-yield written exam materials. Here's just a reminder before we start on what type of view we are using in this image set, and I'll just quickly circle the coronal plane right here. We will be starting on the anterior side of the body and move in a posterior direction as we go through these images. I'll first just draw the borders of the diaphragm so we can clearly define the abdominal cavity, which I'm doing here in red. You can see the heart in the thoracic cavity, and I'll just quickly mark that in yellow, as well as the liver below the diaphragm, and I'm going to outline the liver here in green. Now, the area that you see here, and I'll circle that in blue, are the contents of the stomach. There is a gray structure starting to appear next to the liver, and I'll circle that right here in blue. This is the gallbladder. Now, I don't usually identify muscles in these presentations, but I want to point out the rectus abdominis here because it is just so prominent in this image. And I'll outline that quickly in yellow. The pancreas becomes visible here, and although it's a little hard to define its boundaries, I'll outline it in blue right here. There are a few arteries and veins I'd like to point out on the slide. First, we have the portal vein, and I'll outline that in blue now. Next, the inferior vena cava, outlining that in green for you. And that lies right next to the abdominal aorta, and I'll outline that in red. Now, the bifurcation of the abdominal aorta is very clear in this slide into the left and right common iliac arteries, and I'll outline where that bifurcation is in yellow. If you look closely at the abdominal aorta here, you can actually see the left and right renal arteries branching from it. And so I'll very carefully outline the right renal artery and then the left. A structure posterior to the stomach is coming into view, and I'll circle that right here in light blue. It's very small right now, and that is the spleen. We can also see the right kidney coming into view. I'll circle that in green. And you can tell we're very far posterior in the body due to the presence of vertebral bodies, which I just circled one quickly in yellow. The left kidney is starting to come into view here, and I'll circle that in green. Its entire shape will become more visible in the upcoming slides. Here, both kidneys are now clearly visible, as well as the renal pelvis, which is a darker gray than the kidneys. And I'm just going to outline the edges of those right now in yellow. I want to point out another large muscle here that you may have noticed before, which is the psoas major, and I'm outlining the boundaries of that in blue. The stomach has disappeared, leaving the spleen, which I'll circle in red right now, very visible. Both kidneys have also almost disappeared. The viscera of the abdomen have disappeared. This concludes the presentation. Thank you for watching, and I hope you found this video helpful.